Hi, everyone. I'm Dr. Natasha Guess, and welcome to my YouTube channel. If you're a healthcare practice owner, an administrator, office manager, or a healthcare professional who has ever looked at compliance and thought, I know this is important, but why does it have to feel so complicated? You're exactly who I created this channel for. I'm the founder and CEO of Guess Compliance Consultant, and there's one thing you'll probably hear me say quite a bit around here. Compliance can be simple. And it's not because the regulations themselves are always simple. They're not. But because I believe the way we build compliance into healthcare practices can be practical, understandable, and part of how the work gets done every day. Now, I know you're asking yourself, well, who is this person here speaking? I have spent years working inside healthcare, and I've worked in regulatory environments as well as a lot of compliance environments. My experience includes Medicare and Medicaid regulatory audits, privacy, operational risk, policy development, quality assurance, and helping healthcare teams prepare for the scrutiny that comes with audits and oversight. I'm certified in healthcare compliance, and I'm certified in healthcare privacy compliance, as well as artificial intelligence in healthcare compliance. I also hold a doctorate in law and policy and a master's degree in business law and compliance. And I don't tell you all of that just to list my credentials. I tell you because the way I teach compliance comes from seeing what happens when regulations meet actual healthcare operations. And those are two very different things. Now, over the years, I've noticed something. Most healthcare leaders aren't intentionally ignoring compliance. They're trying to run a practice. They're taking care of their patients, managing employees, dealing with billing, hiring vendors, and they're implementing technology while responding to problems. And they're keeping up with documentation and trying to figure out what AI means for healthcare too. Compliance gets added on top of all of that, and that's where gaps can develop. I found that a policy may exist, but nobody owns the process. You may have a vendor that signed a business associate agreement, but nobody is actually monitoring that relationship. I've also seen where employees may have completed training, but what happens in the actual workflow looks completely different. And most recently, I've seen where a new AI tool may suddenly be used in a practice before leadership has even decided whether it should be. Those are the issues that interest me. Because when regulators eventually identify a problem, the problem often didn't begin on the day the auditor or the investigation started. It began with an operational decision made months or even years earlier. That's why my work focuses so heavily on operational compliance. I am not interested in making healthcare leaders afraid of regulators. And I'm definitely not here to read regulations to you. You can find all of the regulations online. What I want to help you understand is this. What does the regulations actually mean for the way your practice operates? For instance, if OCR announces a settlement, we're going to look beyond the dollar amount and talk about what happened operationally. If CMS changes something, we're going to talk about what workflows may need attention to the change. And if AI continues change in healthcare, we're going to talk about governance, accountability, privacy, risk, and what leadership should be thinking about before a problem occurs. I want you to leave my videos knowing something you can actually do. And on this channel, we'll talk about healthcare compliance, HIPAA, Medicare and Medicaid, audit readiness, vendor oversight, your documentation, regulatory enforcement. We'll talk about AI governance as it escalates and as regulations come out for that. We'll talk about operational risk and healthcare leadership. And we'll definitely break down real enforcement actions. And this is not to scare you, but it is to ask one of my favorite questions. Could this happen in your practice? And if the answer is yes, we'll talk about what you can do now to reduce that risk. As healthcare continues to change, I'll also be talking more about the intersection of compliance, leadership, governance, and artificial intelligence. Because I believe that healthcare leaders who are prepared for what's coming won't simply be the ones who know the most regulations. They'll be the ones who know how to turn those expectations into strong operational systems. So I hope that you'll tune in and you listen. And if you're responsible for leading, managing, or protecting a healthcare practice, or you're a healthcare professional who wants to better understand compliance or governance and the future of healthcare, I hope you'll subscribe and join me here. My goal is very simple. I want to help you recognize risk earlier, make better operational decisions, and build compliance into the way your practice actually works. Compliance shouldn't only become important when an auditor walks through your door. What regulators find tomorrow is often decided by the operational choices leaders make today. I'm Dr. Natasha Guess. Welcome to the channel. And remember, keep it simple, stay compliant, and protect your patients.